Well, good morning and happy Wednesday, everybody. Welcome to Peace Advocacy Group. My name is Claudia Cometa. I am a pharmacist by profession and Chief Patient Advocate with Peace Advocacy Group. As you may know by now, I've been coming here weekly to give you some tips and education on how to be more proactive in your healthcare. Today, I want to talk about how numbers can be deceiving and how you need to know what your numbers are. And so specifically I'm talking about your labs. So often you go get lab work done by your physician or maybe a specialist orders it, and occasionally you might just get a phone call that just says everything looks normal. And what that means is there are ranges for lab results. And so there's typically, say blood sugar, a normal range is, 75 to maybe 100. And so the lab sort of defines what that is for normal. So if you are somewhere in that range, you're considered to have a normal blood sugar. However, it's super important for you to know what your numbers are and not just that they are considered normal, and here's why. Because if you are somebody who, when you fast, your blood sugar runs 75, 80, however, you have it checked again and now it's running 99. Well, that's technically still in the normal range, but that's quite a jump for you because your baseline is around 75. So you might want to pay attention to that because once you hit 100, now you're considered pre-diabetic. So just because a lab is considered normal doesn't mean there's not something you should do about that. So if you know your blood sugar is creeping up, you might want to take some lifestyle changes and sort of change course in the amount of sweets that you eat, the amount of sugar that you add to your drinks, to your food, those types of things. And that's not limited to blood sugar. Platelets is another good example. So, our platelet values can have a pretty wide range, say 150 to 450. You might normally run around 200. However, if you suddenly now jump to 400, well, that's still considered in the normal range, but why do you now have double the amount of platelets in your blood? And platelets are the cells that kind of stick together and help you clot so you don't bleed out. And so that might be something important to know. And on the flip side of that, if you normally run at 400 and now all of a sudden you're 200 or 150, that might be something to be concerned about, especially if you're on a medication that can do that as a result. So the key here is know your numbers. And whether that means and I just recommend for my clients let's get a copy of them. Let's keep them in a file so that we can track the pattern. And if there's something that seems to be a significant drop or a significant increase, we might want to look further into that, even if we're told that the numbers look normal. And on the physician end, if you change physicians, they may not have the information from before, so they might not know what your baseline is. Let's say you moved and you went to a new physician and they don't have all of your records, and you get your lab checked and your blood sugar is 90. That may not be a huge concern to a physician unless they know that you normally run 70, 75. So new physicians may not know, so it's important that you do know. I help my clients with this. Certainly, I would advise you, if you're not a client of mine, to keep good and organized copies of your labs so that you also know what the pattern is. Hope that was helpful, and I look forward to seeing you next week.